going back to the metabolic syndrome, I didn't really complete that, but hypertension, hardening of the arteries, that is a source of inflammation. These very same genes I talked about in obesity, inflammatory cytokines, are also produced by this inflammation within the blood vessels. And those genes cause, again, oxidative stress. They produce what is called reactive oxygen species, or the free radicals that you mentioned earlier. And those are the genes that cause the progression of disease. And it's thought that they may be the cause of prostate cancer, but that's a harder question to answer. But going back to causing progression, they impact on metastasis. They also impact on the growth of the cancer. They also impact on the production of cancer stem cells, which is, those cells are immortal. They change the character of the cancer cells. It makes it difficult to treat. In fact, they are the source of a resistance to drugs when the cancer stem cells are developed. So those are the primary molecules that drive death from prostate cancer, and they're more expressed among African Americans. Now, why? Part of the reason is hypertension, obesity, and diabetes are more prevalent among African Americans, but there may be another cause for them being a higher incidence. Now, I have an hypothesis, but I don't want to go into that hypothesis. But I do want to say that it's not just in this country where men of African descent have a high incidence of prostate cancer. In the Caribbean, as well as West Africa. In fact, in Ghana has a higher incidence of prostate cancer than African Americans here. We were part of that study that was published a few years ago. So it's a very complex issue in terms of the biology and genetics. Perhaps we'll have more time to go into that and more questions may be asked, and I can elaborate.